topic today is lumbar vertebra. There are total 5 lumbar vertebra, in which the first 4 are typical and the last 5th vertebra is atypical. In typical vertebra, you can differentiate the body, which is typically bean-shaped body, absence of costal facets which are present in the thoracic vertebra, and absence of foramina which are present in the cervical vertebra. The body of the typical lumbar vertebra is large, and the transverse diameter is more. Transverse diameter is more as compared to anteroposterior diameter, and the height of the body is slightly greater anteriorly as compared to posteriorly, and due to this feature and more increased height anteriorly, there is forward convexity in case of lumbar spine. Behind the body, this is vertebral foramen, these are pedicles, these are transverse processes, these are superior articular process. The pedicles are short and strong, they are directed posteriorly. Lamina are thick and fuse medially to complete the vertebral foramen posteriorly. This is vertebral foramen, and this is spinous process. These are superior articular process and these are inferior articular process. Now the pedicles are attached to the body in its upper part. In its upper part, that's why inferior vertebral foramen is deeper as compared to superior vertebral notch. Not foramen, notch. Inferior vertebral foramen is notch is deeper as compared to superior vertebral notch. These are superior articular process, more clear in the vertebra, and these are the articular facets which are directed backward and medially. And one important feature you have to differentiate here is mammillary process. On the posterior aspect of superior articular process, these elevations, smooth rounded elevations, are called mammillary process, one of the important distinguishing feature of lumbar vertebrae. Also see, these are the mammillary process. Now these are the transverse process. Transverse process are thin and tapering. Their size increase from L1 to L3 and then gradually decreases. And at the root, where the transverse process join the pedicle and process, there is another roughened elevation. This elevation, it is called accessory process. So we have seen the two processes. One is mammillary process on the posterior aspect of superior articular process, and one is accessory process at the root, posterior and inferior border of the root of transverse process. These are the accessory